Hi, good evening, everyone. Thank you for joining me. Um, Today is a very important day when it comes to reflecting on the science and the lack of science around the pandemic. I have to choose my words carefully here because this is a sensitive topic, and I'm doing my best here to speak about this and duck away from the inevitable question about censorship because a whistleblower has spoken about clots that look like embalmer's clots occurring in the living. To give you background, about in April 2023, I spoke with Tom Haviland for the first time, and he was mentioning the point about embalmer's clots. And um, I've learned to listen because he reached out to me. I listened to what he had to say, shared his research. He was recently with John Campbell. They got over 1 million views on that. And the fact that it wasn't being investigated because he did the research twice and he didn't get the information out. But at the time, I had been working on a presentation, which, if you look in my courses, you will see there's a free presentation on embalmer's clots. And part of my approach was that I said that this wasn't happening primarily in the living. And so, therefore, I thought that this was a post mortem event. What has happened is that recently someone has reached out to me and said, no, this is happening ante mortem. This is happening in the living, similar types of clots. Um, I can't corroborate this kind of evidence, meaning that I don't go and look and I don't go and study. What I do is I talk to people who are afraid to speak out otherwise. So if you look at the video that I've just done, it's on the Substack. The link is below. Please, if you're squeamish, you have to think carefully about watching it because we look at real images of clots and so on, and we discuss around it. I have Dr. Shankara Shetty with me, and we're just trying to analyze it and make sense of it. I think what's concerning me is that this could be happening across the globe because if it's happening in one lab, why would it not be happening in all labs? If it is happening in all labs, why are clinicians not speaking about it? Is it similar to what was occurring here, where this was another clinician, this was a technician working and observing this with many years of experience? How can we have a situation where people are afraid to talk about science? And actually, truthfully, I am afraid to talk about this because of the impact of censorship. But my responsibility is to raise awareness. Just as what happened with embalmer's clots kept on asking the question, you cannot ignore what they are seeing. If they are seeing it, there must be a mechanism. If there is a mechanism, it needs to be explained. What I've learned is that whenever we have a situation like this, there is often the issue around the elephant in the room. Um, it causes problems and it is influencing the scientific approach and it's causing people to hesitate to speak about these kinds of things. So, as I said, if you want to watch the full video, click on the link below. But I've taken a short clip of one of the elephant in the room questions. And again, how can I corroborate this? I'm not looking at all the data, but this needs to be thoroughly investigated. I actually would say at this point that if anyone, if any clinician hears and listens to this video and doesn't feel that we have to ask questions as to whether or not this is occurring elsewhere, I can't understand how we would be able to not damage the future of medicine if this was occurring and we didn't know and didn't investigate. There is a huge responsibility. Here is a clip from the discussion that we had not too long ago, and this is him as I asked specifically about the elephant in the room. Oh, I genuinely am not quite sure what to say, Shankar. So Shankara, what he has been mentioning is that people are noticing this, but there is no safety with talking about it. So let's ask the elephant in the room question. Have you noticed or did you look at any question about vaccination status?
Yes. So I guess there's some that can say that this is caused by COVID itself. There's people that say that it can be in the unvaccinated and vaccinated. But I know the patients, they're my patients, and I have to access their chart. And when I do, I know how many vaccines they had, when they got the vaccine, what type of vaccine. And it seems like the more vaccines that they have, the bigger the problem is. We've have patients now that have up to 8 vaccines, 8, but we also have patients with one.
So what percentage do you think of the cases like this? But you have to be careful now because you are highlighting the worst cases. But even so, is there any kind of percentage you can imagine, vaccinated versus unvaccinated?
Well, I could only speak to my lab, and in my lab, it's 99% vaccinated.
And is
Okay.
this for all clots or just these big clots?
I'm speaking about the white fibrous clots.
Okay, so whenever you see a white fibrous clot that looks abnormal, the stretchy type, and then how often would you see that? One a week, one a month? And even that, what percentage of cases tend to have these white fibrous clots?
Oh, it's a big problem now. We seem to be only treating the white fibrous clots now, because I think what has happened is that the doctors are racing to treat with heparin, TPA. And as they do that now, because right when they hear blood clot of any sort, they will treat immediately. And when they treat them with the heparin and other blood thinning drugs, the normal clots dissolve immediately, I believe, and those patients don't have to come to us. The white fibrous clots is the majority, and we are now seeing about anywhere from 3 to 10 a week.
Wow. In the
Yeah.
white, and in those patients, so what you are saying is that in the cohort of patients who have white fibrous clots, 99% are vaccinated?
Yes, sir.
Yeah. Again, what can I say? Um, if someone reaches out to me with this kind of concern, and you have to listen to the full video to understand why finally he decided to talk about this. And my job is just to ask the questions. And as I said, I can't corroborate this. But I knew from the time we were seeing Embalmer's clots that this was not normal and should have been investigated because the question was, could it have been happening in the living? I genuinely thought this was a post mortem thing and it may have been related to a number of factors. If this is occurring in yeah, the implications of that are very, very serious. This is what I'm saying. At this point, my job is to continue to raise awareness until the regulators, the scientists answer these questions. It is no longer acceptable to say you don't think. We need to know. And if this is occurring, we need detailed pathology on it to understand exactly what are the compositions, where are they, how do we identify who is at risk, what can we do if they are not responsive to anticoagulation and heparinization and thrombolysis. What are the implications of that? Do they go away in time? There's so many questions that need to be answered. This is just the beginning. And yes, this was an eye-opening experience for me. And as I said, all I'm doing is sharing the information, thinking carefully about it, trying to figure out how I can get more research done, because that's what we need at this point. We need detailed, thorough analysis to be done, and we have to get away from this politics. It is completely disintegrating the way how science is done and how medicine is done. There is a responsibility to patients, and it is very sad that people are so concerned that they don't want to speak about this. And even when they do, they have to do it anonymously, but just raising awareness. Anyone who knows a clinician, push them. Let them answer the question. If they don't know, they need to know. Everybody needs to ask. Have a good evening.